Good morning, I'm Dr. Kerry Chant from New South Wales Health with a COVID update for Saturday the 4th of December 2021. There were 325 cases of COVID reported in New South Wales in the 24 hours to 8 p.m. last night, and there were more than 65,000 tests reported during that period. We are reporting a total of 13 cases with Omicron variant, and the results on further cases are likely due to later today. Currently, we have 139 COVID cases admitted to hospital, with 25 people in intensive care, 8 of whom require ventilation. Pleasingly, our vaccination coverage is also inching progressively higher, with 94.6% of people aged 16 and over having received their first dose, and 92.7% are fully vaccinated. Sadly, New South Wales Health is reporting the death of a woman in her 50s from southwestern Sydney. She died at Liverpool Hospital. She had received 2 doses of vaccine and had underlying health conditions. Can I express my sincere condolences to her family for her loss. In terms of the outbreak that we're currently investigating of the Omicron variant, it's linked to Christian School, Regents Park Christian School in Western Sydney, but also the Sydney Indoor Climbing Gym. We have advised people at the school and also at the climbing gym of the actions that they need to take in order to prevent the further spread. But can I actually thank the school community? It's been an amazing turnout for testing. Many of the school community turned out yesterday for testing, and that's really been useful in us getting a rapid understanding of how the transmission has occurred. So thank you. Continue to follow that public health advice, and if anyone develops symptoms, please get tested. I would like to also remind overseas travellers of their obligations under the public health order to get tested in the first 24 hours after arrival and again on day 6, and also the need to isolate for those 72 hours. We are currently responding in New South Wales to both cases of Delta and Omicron. It's been so pleasing to see the stabilisation of cases in regional New South Wales, and can I thank the regional communities for their amazing response. We are starting to see a bit of an uptick in cases in metropolitan Sydney, so please continue to go out and get tested. Take those simple measures to keep you and your loved ones safe. And importantly, anyone who is unvaccinated, please get vaccinated, and also check your eligibility for booster shots. Throughout this week, we've been reaching out to our international and local experts to further understand the rapidly evolving information about the Omicron variant. We spoke with South African researchers recently, and we're also working with experts in other countries. It is so pleasing to see the sharing of data as we try to understand Omicron's key features. The key pieces of information we need to understand is how easily it spreads, how severe the disease is across all age groups, whether past infection with previous strains protects or modifies the disease severity, and how effective our current vaccines are at protecting against severe disease and what impact they have on transmission. Experts across the globe, including our own experts, are working to get these answers as rapidly as we can. And we hope in coming weeks, as countries have been able to grow the virus, we'll have some answers in relation to vaccine protection. In the laboratory, we're able to test whether the virus is able to be neutralised by antibodies developed through vaccination, and this will be a key piece of information that assists us in better understanding the protection afforded. We are working with the National Centre for Immunisation Research to document how the transmission has occurred in our clusters that we've had in New South Wales. And again, we're very committed to sharing that information internationally as soon as we can, as we all try to grapple with to gain a better understanding of the impact of this variant. We know that booster doses are important at increasing the protection levels of those antibodies in our blood that provide that protection. And so it is important that we can get that turnout for those boosters. ATAGI's updated its advice on Friday, and we know that ATAGI will continue to monitor the emerging international evidence in relation to boosters And I just want to acknowledge the hard work of ATAGI in monitoring this situation so closely. We are incredibly grateful for the rapid sharing of information also between the states and territories as we work to understand more about this new variant and also control its spread. So my key message is be vigilant for the symptoms of COVID, immediately get tested for COVID and isolate until you receive a negative result should you develop any symptoms. But take those simple steps to keep you safe. Continue to wear masks in indoor environments. Choose those outdoor settings, particularly for larger gatherings if that's an option. But most importantly, don't go into settings if you have got symptoms of COVID. Instead, get tested and stay at home until you've got a negative result. Thank you again to the community for their amazing response, and we'll continue to keep you updated in the context of this rapidly evolving situation.